Welcome back. To continue our discussion on stroke, joining me again is Dr. Justin Thankachan. He is with St. John's Health Center, and you are with the Stroke Center, a hospitalist, and internal medicine. Well, let's jump in. Now, when we finished, we were talking about ischemic stroke and sort of defining what that was and sort of cholesterol and its impact in that. Let's talk a little bit about signs and symptoms. How would individuals know that they have an impending stroke?
Some of the five biggest signs and symptoms I would like the viewers to be aware of would be, number one, if they or a loved one are starting to experience a sudden loss of numbness or sensation or a loss of strength or weakness in the muscles of the face, arms, and legs, especially if they're all on one side of the body.
Okay.
Number two would be if they have trouble with their speaking, or their speech sounds a little slurred, or that it's difficult for people to understand them when they're speaking, or they have trouble understanding other people.
Okay.
Number three would be if they have blurry vision or trouble seeing in one or both eyes. And then number three would be if they have trouble walking, or they feel like they're really dizzy or having problems with coordination and balance. And then the last one would be if they have a severe sudden headache that couldn't be explained by any reason at all.
Now, people may be wondering, do you have to have all of these things at once, or is it any one of those, or you have to have at least two?
Any one of those. If you have any signs or symptoms of any one of those, and even if they go away, we should definitely seek immediate help by calling 911. Because any one of those, you do not need to have all four, or any single one is enough to be considered a stroke criteria.
Now, when you talked about headache, because many people may say, oh my goodness, well, sometimes I have headaches just out of the blue, and then they go away, or I take something and they go away. So tell me a little bit about the distinction in this type of headache that you're talking about, because we can have them that come on suddenly, but this one must be pretty different.
Absolutely. It's different in the fact that what we usually call it is a thunderclap headache, or it's one of those, it's the most severe headache that you've ever experienced before, and it comes on suddenly without, usually when we talk about severe headaches, we talk about people with migraines. You know, they tend to have auras, or they feel like it's coming on, but some people don't. Or it's, you know, everyone has tension headaches, or there's different types of headaches that people have, but we're used to those headaches. So even though we don't like them and they're not appreciated and we wish they would go away, we know what those feel like. But whereas this would be a different kind of headache, it would come on very abruptly or suddenly, and it would be one of the worst experienced headaches we've ever had.
Okay, and like you said, and those are the 911 kind of calls we should make.
Absolutely.
Now, when we think then about these signs and symptoms, is there a certain age category that you might be more prone to stroke or not?
Certainly. I mean, age is definitely a risk factor. Unfortunately, it's one that we can't change. And definitely the older you become, the older you get, definitely your risk of having a stroke increases. And it definitely increases after the age of 55. Okay.
Now, is there any kind of sort of predisposition or genetic factor to stroke? So people may say, you know, I had an uncle or an aunt or somebody in my family that had a stroke, so would they potentially be at greater risk?
Oh, absolutely. I mean, there's many risk factors for stroke, and we like to generally classify them into two broad categories. What we call the modifiable, or risk factors that you can change, and then the non-modifiable, or the risk factors that you cannot change. And family history, or even in some cases personal history, definitely is a risk factor. And unfortunately, that's a risk factor that you cannot change. I mean, the family you have is the family you have. That's the way, you know, you were created. And so if you or a loved one, especially such as a father, mother, brother, or sister, especially in the primary or the immediate family, has suffered a heart attack or a stroke, that is definitely a risk factor.
Okay. Now, what things such as high blood pressure, because we hear about high blood pressure being a culprit in a lot of conditions. Is it one here where if a person has high blood pressure and they're not controlling it very well or don't know they have it, is this something that can contribute to stroke?
Absolutely. That's definitely one of the modifiable risk factors, or risk factors that you can change. And those all consist of smoking, high blood pressure, diabetes, high cholesterol, physical inactivity, and being overweight. And high blood pressure is definitely one of those risk factors. There's a lot of people, especially African Americans, that do not know that they have high blood pressure, and there's such a strong family history of it. So we definitely encourage everyone to go to these health fairs or screenings where they can have their blood pressure checked for free. Most of the pharmacies or grocery stores will have a blood pressure cuff. While those are not as reliable or as accurate, we definitely recommend that people get those done, or go see their primary care doctor and check your blood pressure, because uncontrolled high blood pressure is definitely a risk factor, not only for stroke but for diabetes. For heart attack as well.
Okay, now how often should a person think about getting their blood pressure checked? Because you may have people, of course, and we know about the yearly checkups are very critical. But should a person get their blood pressure checked more frequently, every couple of months, once a month? Every 3 or 4 months, especially if they don't have high blood pressure, they think.
Absolutely, and that's why I would say blood pressure, how often you check it or the routineness of it should depend on how well you're controlled. If the person is very well controlled and has no other risk factors and is not requiring medication or significant lifestyle modifications, once a year should be more than adequate. But if there's a patient who's requiring 4 or 5 medications to control their blood pressure, and despite lifestyle modifications it's still really high, they should definitely be checked a lot more frequently. Okay,
and another thing too I want to bring out, because we do talk about blood pressure being the silent killer, but there are people that will say, doctor, well, I could tell if my blood pressure was high. You know, I could really tell. Medically speaking, can they really tell?
They might be able to tell, but usually when they're able to tell that their blood pressure is really high, is usually a sign when things are going really bad or it's too late.
Okay.
And that you do not want to wait for a physical finding, or you do not want to wait for a symptom, because that's your body's way of saying something's wrong. And we want to try to prevent these things from happening, which means catching them sooner than before you even realize it.
Okay. Now, when we think then about stroke, we talked about the 911 phenomena and to be able to call. Before we go to break here, initially, what is going to happen when we call or we come into the stroke center? What can we expect to happen?
Usually it'll start by initiating the emergency response system by calling 911, and the EMT or the technicians out there on site are able to, they're trained to look for and recognize signs and symptoms of a stroke. So by doing that and notifying this as a potential stroke patient, they're able to call in early to a facility that has designated themselves as a stroke-ready facility. And not only is that good for the patient, because they can bypass, waiting in the emergency department waiting room, waiting for their name to be called. And it's, because stroke will be treated as a critical illness, just like a chest pain for a possible heart attack. And they're able to be moved to the front of the line and be placed in a room immediately. It's also good for us as providers, because we can get our end ready so that any players that need to be involved in the patient's care can be ready to receive the patient as soon as they arrive.
Okay, and we're going to take a really quick break and come back and talk about then what happens to us treatment-wise. And also want to ask the question of, can a person have had a stroke and not even know it? So we'll be right back, and you stay there, okay? And we'll be right back.